Good evening, and welcome to Microbiology Microsegments. Everything you need to know about the latest news in microbiology in only 5 minutes. For tonight's story, we'll be covering antibiotic-resistant tuberculosis, otherwise known as TB. Although the disease has been around since ancient times, a new strain has been reported with complete antibiotic resistance. The first case has been reported by a man visiting the U.S. from Peruvian. This strain has been identified as XXDR-TB. Here to explain more on this breaking news is Dr. Washburn, MD of Heartland National TB Center. So what are the symptoms of TB?
Well, patients with tuberculosis are often misdiagnosed with lung cancer because the symptoms can be identical. These symptoms include excessive coughing, weight loss, fever, night sweats. They can, though, differ from patient to patient.
How exactly do you treat this?
If caught soon enough, the disease usually is curable, except in the case of a new strain, such as our special case here. Unfortunately, the bacterium can live and grow in the lungs for months without showing symptoms. When caught, patients have to take highly toxic drugs, such as rifampin and ethambutol, every day for about 6 months. The process is lengthy because we have to completely rid it from the body.
We interrupt this segment for a message from our sponsors.
Man, my throat really hurts after all this coughing. Good thing I had my swell bottle to keep my water nice and cold.
Good evening, and welcome to Microbiology Microsegments. Everything you need to know about the latest news in microbiology in only 5 minutes. We cut to Dr. McCormick, PhD of Harvard, renowned TB historian. Can you give us some more background information on the history of tuberculosis?
Tuberculosis has plagued humans since before the Middle Ages. A diagnosis with this consumption disease in the pre-antibiotic era would have been similar to a modern diagnosis of cancer, where patients were left feeling hopeless. Tuberculosis was originally treated with therapies such as gold, arsenic, cod liver oil, herbs, bed rest, sunshine, and fresh air, which were not really effective. Therefore, tuberculosis was considered one of the most deadly diseases of this time, and the term white plague arose. In 1882, Robert Koch helped develop a foreseeable hope for a tuberculosis cure when he created a visible strain. The implementation of new drugs caused an immediate sharp decline in tuberculosis throughout the world, which brought euphoric hope to people of great success and total control over the disease. Some people even predicted that tuberculosis would be completely eradicated from the world. However, the disease came back in the 1980s with outbreaks that had multi-drug resistance, and the disease became associated with acquired immune deficiency syndrome, or better known as AIDS. It is estimated that 2 million people worldwide, which is 1/3 of the human population, is currently infected with tuberculosis.
We interrupt this segment for a message from our sponsors.
This microbiology test is getting me really tired. Good thing I have my swell bottle to keep my coffee hot.
Good evening, and welcome to Microbiology Microsegments. Everything you need to know about the latest news in microbiology in only 5 minutes. We cut to Dr. Lee, head of the Ecology and Evolution of Antibiotics Resistance team of the Pasteur Institute, on the significance of antibiotic resistance.
Thanks, Hope. The reason TB is resistant to antibiotics is due to the low permeability of the unique cell membranes. Anytime a strain of TB isn't totally eradicated with antibiotics, the bacteria will develop mutations in efforts to resist the antibiotic. This, in conjunction with low drug quality, incorrect prescriptions, and poor adherence to prescriptions, have led to the significant and global spread of antibiotic-resistant TB. So, every time a drug is developed to target a strain of TB, the bacteria will mutate, rendering the drug useless. While there is much effort to develop new drugs, research is costly and serendipitous. This obviously poses the frightening question: do drug-genotype interactions make it inevitable that resistant strains will spread through TB and human populations? Or can resistant strains be contained by prompt diagnosis and by achieving the highest possible cure rates with drugs?
So how do you feel about that M-Bio test?
I don't know. I'm sweating. That test was real hard.
Do you want some ice cold water for my swell?
Thanks. And who knows? Maybe I'll give it some extra credit.
There you have it, all you need to know in 5 minutes. Don't forget to tune in tomorrow for our guest expert, Bradley Stevenson, speaking on the subject of magnetosomes. This has been Microsegments.